Well, good evening, everyone. My name is Chris Montini. For those who don't know me, I'm joined here by Assistant Superintendent Melissa Cooney. She and I will share with you today and highlights and overview of our Safe Return to School plan. We are excited to be here in front of you. We can't see you, but we know you can see us. Hopefully right now, as I'm doing this introduction, if you're unable to hear me, give us a shout out in the chat and I'll adjust the microphone. Another 30 seconds, we'll get started. I see some people joining now. Great. So what I hope to do in the hour that we've put aside this evening for this forum, for the webinar, is to review the highlights via a PowerPoint, get into an opportunity on the back half of the last 30 minutes there to review questions that were submitted in advance, and then open them up to using the chat to those on the other end of the screen there. So that said, for the past 20 months, approximately 20 months, we have been guided by the principles that you've seen permeating our documents, our screens, our presentations. We continue to be guided in this pandemic by the decision-making guide, our guiding principles. Personal relationships are the heart of everything that we do. Establishing and strengthening personal relationships with our students, families, community partners is essential to our work. Health, wellness, and safety for all has been a focus. Certainly it's been a focus in the context of this pandemic, where we're making decisions on protocols, procedures, policies as they relate to health, safety, and wellness, guided by experts in the field. Meeting and exceeding high expectations, challenging each and every one of our community members to achieve their very best, surpass their very best, reach and exceed high expectations, and become the vision of our graduate. And access and opportunity for all, providing students, looking at everything through an equity lens and providing students what they need to achieve and succeed, and staff as well. So we continue in our return to school plan this year, our Safe Return plan, to be guided by these principles. We will return, as previously communicated, as I'm sure you're all aware, we'll return to full-time in-person learning for pre-K through grade 12 and adult education this September 1st, the first day of school. While we're hopeful that we will remain in person the entire year, we are prepared to shift to alternative models if necessary. So we're fully in person. We have contingency plans for short-term distance learning in the event that individuals need to quarantine or self-isolate, or a classroom needs to quarantine or self-isolate, or a classroom, or perhaps a school. We're also prepared to shift to 100% distance learning if required or mandated by the CSDE, DPH governor, or if needed. We are prepared to support the return to in-person learning, especially those distance learners who have not been in our schools in person for quite some time. All of our schools have school-based support teams. They meet regularly. These teams include counselors, social workers, psychologists, teachers. Teams review the success of students social, emotionally, academically, ongoing throughout the year. We'll be reviewing the transition and providing and developing plans to support students as necessary and as needed. We have expanded our summer school, so we have academic and social, emotional, and mental health supports for students as we return in the fall. We've expanded summer school this past year. We at least tripled the amount of students who participated in summer school and credit recovery at our high school. We are now we completed day 3 today of the Kindergarten Transition Academy. Had a couple of teachers here in the BOE shared very positively about how the Transition Academy was going. We will be providing an extended day programs in our schools before, during, and after school time. That'll vary by level. More information later in the fall in regard to extended day programs. We've engaged in curriculum development over the summer, and we'll continue to revise and improve our curricula over the course of the year. We have lined up professional development to support academic recovery. You'll hear us talk a little bit throughout the year about acceleration. And we've hired some additional classroom teachers based on class size. We've partnered with community agencies this year so that we have additional support to support mental health. Those services will be available no matter what learning model we're in. They're prepared to support virtual. They're prepared to support in person. And we've hired some additional support to support SEL and mental health. And we'll be implementing a new program at Naugatuck High School. So we're excited about some of the new initiatives that we'll be returning to. So I would say there's a few questions that we get a lot of. So certainly there's questions about masks, there's questions about remote learning, and there's questions about spectators at sports, not in any particular order. So in regards to the distance learning option, and some of the folks who have reached out and asked why we're not having a distance learning option for families, in short, it's not permitted by law. So last year, the governor, through executive order, the legislature, they mandated that and allowed for a distance learning option for families based on the state of emergency related to the pandemic. That provision is no longer allowed by law. What is allowed this year is short-term distance learning to support students in the event that they need to quarantine or self-isolate based on as indicated by our health department. So in the subsequent slide, you'll see that we'll explain how we plan to support students remotely when they need to quarantine and or self-isolate because of COVID. And at the bottom, you'll see it's important to note that students who are absent for reasons other than COVID will not receive remote learning support. It's really related to, the provision is only related to emergency absences as they relate to the pandemic. So on this slide, I'll talk a little bit about, and I know there's a lot of words, but the short-term remote support that we are prepared to provide students in the event they need to quarantine or self-isolate because of COVID-19. Teachers, like last year, will continue to post assignments electronically in Google Classroom. Students will have those assignments to complete asynchronously. Asynchronously means not live. So on their own, the assignment, not joining the classroom live, that would be synchronous. An MPS staff member will provide the student with a virtual grade level check-in. So it could be with some other grade level colleagues or peers rather from the school, across schools, to support, check in, and provide some guidance on those self-assignments, on those asynchronous assignments from Google Classroom. Grade level check-ins will be offered once in the morning and once in the afternoon. Classroom teachers will continue to review the assignments, provide direct feedback to each student in their classroom. They do the grading, they do evaluating of the work, they will post the feedback to the student, but they'll be getting support from a staff member that is likely not their classroom teacher. In the event that a building, classroom, or cohort of students must quarantine, we will then get information out to you, either my office or individual school principals will send information on transitioning for the classroom and or the school regarding distance learning, shifting to distance learning temporarily. And another note, the provision that I spoke of a few moments ago, remote learning can't be used for inclement weather days. So as of right now, snow days will be traditional snow days made up at the end of the year in June. A note though, a caveat I think to this presentation is that all things in this time of the pandemic and COVID are fluid, and we'll keep you abreast of any changes that may develop and or guidelines that may be issued. So the next two slides are basically the main operational considerations and mitigation strategies that we'll implement. A lot of the strategies are a continuation of what we had in place this year with some tweaking. We will continue to cohort in grades K through 8 when possible. A cohort, as you know, is a group of students that stay with each other consistently throughout the day. There will be in 9 through 12, we will not cohort. We did not last year. As communicated, universal mask policies. Masks are required by Executive Order 13A from Governor Lawat through September 30th in our school buildings. That is staff, and that is for students as well. Hand washing and sanitizing, a great strategy, is the importance and the frequency with which we have our staff and our students wash and sanitize their hands. We'll continue. We have schedules, and we'll continue to provide multiple opportunities for that throughout the day. Physical distancing. Classrooms will be configured to maximize spacing and physical distancing. 3 feet will be our standard. You'll see in a couple of slides that 6 feet is really still the standard for contact tracing, but 3 feet rather is the standard in all school buildings for our spacing. Cleaning and sanitizing protocols will be used once again in our schools. The likelihood of transmission for COVID on a surface is virtually non-existent. So some of the stringent protocols have in regards to deep cleaning, those have gone away. As a matter of fact, DPH, CDC, they don't even use those words anymore. Regular cleaning and disinfecting consistently on our schedules are both effective and recommended. And of course, I'm going to get into the health protocols a little bit and talk about quarantining and self-isolating in a slide or two. So transportation, per federal order, masks are required on public transportation, which includes our school buses. We expect school buses, now that we don't have a remote learning option, will operate close to capacity. Physical distancing will be maximized to the extent possible, but our buses will be fuller. If you're a parent that is able and willing to transport your child to school, that would be great. If not, we'll have a seat for you, but there'll likely be less space and less spacing on our buses this year. For technology, we'll continue to provide all students with a school-issued Chromebook that they'll bring back and forth to school each day. That's important so that we can provide for the continuity of learning and ensure that each and every one of our students has access in the event that we need to change learning models. Lunch, we have different schools based on their school facilities are doing some things a little differently. And I have listed here in that center box, Andrew Avenue is going to have lunch in the classrooms, Hopbrook combination of classrooms and lunch. Same with Maple, Salem and Western are in the classrooms. Cross Street's a combination of classrooms and CAF, Hillside in the classrooms, City Hill classrooms and CAF, and gym and CAF for the high school. I should also note that all schools have a tent outside that they will be able to utilize for outdoor activities, including lunch, weather permitting, of course. We'll continue to have before and after school care. Spark will be at Maple Hill and Hopbrook. This year, we're able to bus students from Cross Street to Maple, since we don't have a site at Cross Street, and those students will be kept separate from the Maple and Hopbrook students as a cohort. The Y will be at Andrew and Western, and all of our after school care programs will follow our health and safety protocols. Just bear with me 1 second. I'm going to take a sip of water here. So a question that we've received also is special area classes. Students may travel to their special area classes. That's unified arts or their electives in the upper grades, their gym, the art room, etc. Individual school practice will vary. Some might not have an art room. They may go to a different space for art or have it pushed in. So really, some of that information you'll get, school-specific information you'll get from your principals. But they will be, to the extent that they're able, given the facilities, leave their classroom and travel to their special area class. Question that we received too regarding recess. will students stay with their class/cohort during recess? And the answer is yes, they will, at least to start the year as we monitor our plans. We know outside they're not going to have to wear their masks, and they're going to be hopefully enjoying some really nice weather this fall. As we monitor our current context, we'll monitor the ability for more than one class to populate an area, at recess moving forward. But right now they'll stay as a cohort. So our next few slides, we're going to talk about those health practices that I referred to a few minutes ago. And that's the confirmed case of COVID, the exposure to COVID, and if you have symptoms but weren't exposed to COVID. So now that we have a decent vaccination in Connecticut, and vaccination enters our protocols, you'll see that some of the policies and protocols and procedures separate out for vaccinated and unvaccinated folks. So for a confirmed case of COVID-19, employees and students with a confirmed case of COVID-19 will return under the following conditions. At least 24 hours have passed since the recovery, which means they're fever-free without any medications, and their symptoms have improved, and 10 days have passed since the onset of symptoms, and symptoms are improving. So 10 days out for COVID, if you're fever-free, if your symptom has improved since the symptoms developed. If we're unable, then we may use the date of the test. We don't know when the symptoms started, right? So that's 10 days. It's not really any different than the protocols that were in place last year. So now let's talk a little bit about a close contact. So the DPH and CDC defines a close contact as spending 15 minutes within 6 feet with a person with a confirmed case of COVID-19 within 24 hours. And that's cumulatively over the 24-hour period. This year, CDC has an exception in their definition of a close contact for students in a classroom setting, only students, not teachers, not other employees, only student to student in the classroom. So not on the buses, not in the hallways, not at recess, not in the cafeteria. Students do not need to be considered a close contact if they're not within 3 feet. So if they're 3 feet or more in a classroom, masked appropriately the entire time, then that's an exception to the 6-foot rule for contact tracing purposes, for exposure purposes. I will say, though, if students eat breakfast in the room, and our practice is that students eat breakfast in the room, we have far too many students where eating breakfast every single day, where given our facilities, or given our schedules, students, when they unmask and eat in the classroom, that would trigger the 6-foot rule, right? The exception wouldn't apply if they take their masks off to eat. So when we are talking to you parents and folks about close contacts or contact tracing, know that that'll be in the conversation, as if students had their masks off and were eating, then the 3-foot exception would not apply. So now let's talk about what to do if you are exposed. So we know the definition of close contact is 6 feet within 24 hours. 3 feet exception, student to student, masked in the classroom. So now if you are exposed, if you're an individual and you're not fully vaccinated or your vaccination status is unknown, the quarantine is for 14 days from exposure to the positive individual. You can test out of the quarantine, meaning you can return a little early, 3 days earlier to be exact, if you get a negative PCR test taken no earlier than 7 days after the last exposure. So if you're exposed today, 7 days, on day 7, you can get a PCR. If it comes back negative, you can return after 10 days, which is a return on day 11. The negative test must be provided to the school nurse. So this is a change from last year where it was 14 days. Now we have the option to go back after 10 days with a negative PCR test. If you're fully vaccinated and you do not have symptoms, you provide proof of vaccination. You don't have to quarantine. It's recommended that you should test 3 to 5 days after the exposure and that you should wear a mask in public out of you in public whenever you're out of your home until the 14 days have passed, or you've received the negative test. If symptoms develop, stay home and consult medical and seek medical advice. So if you're exposed and you're fully vaccinated and you have symptoms, you have to provide proof of vaccination, quarantine, stay home and get tested, and you can return to work with a negative test and when symptoms have resolved. So this is new this year as well. And again, that's just for fully vaccinated. Non-vaccinated, it's after 10 days, so on the 11th day with a negative PCR taken on day 7 or later. So just framing this out, we have exposure. We have positive cases. Then we have exposure to somebody who is positive. And next we have symptoms, not exposed though. So if you're an individual, an employee or a student with symptoms, you can return under the following conditions. 24 hours have passed since recovery. Again, same as previously stated, when you are positive, that means resolution of fever for 24 hours, improvement without any fever medication, and improvement in the other symptoms that you may have, and 10 days have passed since the symptoms first appeared. Now, in lieu of that process, you can provide to the school nurse a doctor's note indicating an alternative medical diagnosis. In our experience, there's not a lot of doctors that will have been writing those. However, it is an alternate medical diagnosis or a negative PCR test, and then you can return. The nurse will guide you through this. If you have symptoms, you'll be discussing this with the school nurse. So alternate medical diagnosis or providing a negative PCR test result will be required. If you don't do those things, then it's out to 10 days from the onset of symptoms, as long as at the end of the 10 days they're improving and you're fever-free. Okay. So during the quarantine period, and so this will be ongoing, consistent sites that will be up and available every day. So food services during quarantine and self-isolation will be available. We have a location on both sides of town, and you can go between the hours of 6:30 and 7:30 a.m. to Naugatuck High School, and you would receive breakfast and lunch for that particular day. Or you can go to City Hill Middle School between the hour of 8 a.m. and 9 a.m., and you would receive breakfast and lunch for that particular day. So visitors, I know people are, there's a number of folks that would like to get back to volunteering and being in our schools, but really right now, the guidance that's coming out from CDC, from the state of Connecticut in the new Adapt, Advance, Achieve document is we limit visitors to essential folks only during the school day. So visitors are going to be limited. When someone has to come, call in advance, do the self-screening at home, wear a mask, make an appointment, and we may come out, and if you're bringing something that your child forgot, we'll likely meet you outside. If it's a PPT, you'll have or PPT or a 504 meeting, you'll have the option to conduct it virtually, or we will schedule in advance, again, wear a mask, do the self-screener to make sure that you're not entering with any symptoms, and we'll conduct the meeting in person. Depending on how large the meeting is, we may do it like a hybrid where some of our folks are in the room with you and they're joining virtually too. In addition, volunteers, and we value you volunteers, and we long to get you back in our buildings too. Right now, those are not essential employees or essential to our operations. So we're holding off on volunteers for the time being as well. That said, things like PTO meetings, they could take place at night after school when school hours are over, because students won't be in the building. The adults will go in masked and be able to separate, or use the tent outside, even better, have your PTO meeting outside. So our schools will be open to outside folks using our schools, but it'll be outside of school hours following our protocols. And again, this is like a lot of other things. We're going to continue to evaluate this throughout the year, and we'll revisit whenever we're able to. So I spoke of this at the last board meeting. This year we'll have a K-6. We're in talks with the state, who was going to provide a screening testing program, voluntary, totally voluntary. There will be written consent that you would fill out prior to having your child tested, swabbed weekly. It's being provided by the CES, by the state of Connecticut. It's recommended by CDC, DPH, and CSDE. And it's for the K-6 schools. It's for the schools that are not age eligible for the vaccination. It'll be a COVID-19 PCR testing program for unvaccinated students in grades K through 6. Again, voluntary, and you'll receive individual notification in the event of a positive test result. The testing program is not if you have symptoms or not if you're sick. We don't want people coming to school if you're not feeling well. Those you would do outside at a testing clinic. Even the clinics, most likely, if you have symptoms or you're suspected, they don't like having you come in, and they often do some kind of drive-through process for that. So more information to be coming to you K-6 schools once this is finalized. Again, it's voluntary. We'll give parents the choice, and we'll see how it goes. But just so you know, maybe elaborate a little bit more on this. It would be partnering with a vendor. The school would provide the space, and the school would help with the scheduling. Students would come out once a week to that space. The healthcare professional with our partner organization would do the swab, and then they'd get back to their regular schedule. So a fall sports update. All fall sports are a go. They're permitted. We're looking forward to a season. Hopefully our athletes get vaccinated. That's the best way of keeping kids on the field. Outdoor sports, no masks. That's football, soccer, cross country, and cheerleading. Indoor sports must wear masks. So volleyball, cheerleading, and swimming when they're not in the water. Much like I think we saw some of the Olympic folks doing this year as well. Fans are permitted to attend all sports, but must follow any mask and health guidelines in place at the time. So right now, if a fan goes to a volleyball game inside, we're going to ask them to space out from other families and wear a mask. If you're going to outdoors, you don't have to wear a mask currently, but we're going to ask families to space themselves out. Again, this is subject to change based on the current context, and we'll stay in communication with you if in fact any guidance or guidelines change. So I don't have a slide for it, but after school clubs and activities such as that, that will come from your schools. Those are permitted if they're approved by the school as well. So we're going to go through in the next few minutes the questions that were sent to us in advance through the form that I sent out via the letter, and then we'll open it up to some questions in the chat. Some of these I may have answered, so I might move quickly through some that we've answered, but I know people have joined late. So repeating myself, I think, is totally fine. It'll be recorded also, just so you know. It'll be recorded for those that didn't have a chance, if you know anybody that didn't have a chance to join. So there's 5 or 6 slides, maybe about 18 questions that were submitted. So yes, students will have recess as a class cohort to start the year. How will specials work? Students can travel. They may travel to a class for a special area class, the art room, the gym, etc. Music. Individual school practices will vary more from your individual child's school. Will you require sign-in sheets at the classroom to be able to quickly contact trace? Schools that used this strategy successfully last year will continue to use it this year. Chromebooks are heavy for K and 1 students. Is it necessary for bringing them back and forth? Can we have a designated pickup time if we need to shift? This for us really comes down to equity, access, and opportunity based on our experience. So we are going to maintain students continuing to bring them back and forth. We'll work with them if backpacks and things get to be heavy, but we need to ensure that all students have access and opportunity to engage with their work. And our recent experiences with designated pickups result in too many students not having Chromebooks for too long of a period of time. What exactly is being done to support students and distance learners at all grade levels? So I spoke a little bit before about the grade level, or rather the school-based teams that we have that meet all the time, meet ongoing to review our students' academic and social emotional success and the transition. Schools are going to know and have lists of their distance learners. They're going to seek them out. Some of our schools had some tours and things this summer. Some of our schools that have transition years have invited folks in. We certainly are super excited to welcome back all of our students, especially those that we haven't seen in a long time. We're equipped with additional social and emotional supports. I think I spoke to them a few slides ago, where we have more, for lack of a better term, mental health providers, partnerships with community providers, and additional staff to support students. And the school-based support teams will be planning for that transition, checking in with kids. Counselors will be checking in with kids. Teachers will be working with and reaching out to counselors, social workers, psychologists, et cetera, so that we can provide the supports that all students need to be successful. After September 30th, is opting out of masking an option that will be available. So the mask policy we know is in effect through September 30th, and we will issue an updated policy beyond September 30th based on any information that we receive from the governor, the state, and DPH. So to be continued, we'll see with that. Will any day of the week be a half day for deep cleaning like last year? No, we're going to return full time with full school days. That's how it stands now. As again, we'll have contingency plans if the context or the environment shifts. And again, DPH has indicated that regular cleaning and disinfecting is effective, and that's what's recommended. What study did you use to make your mask mandate? When was it published? So we didn't use a study, and that's a theme that will run through a series of questions here. Masking is required in all school buildings, right? It's based on Governor Lamont's Executive Order 13A through September 30th. It's currently, mask wearing that is, recommended by the Centers for Disease Control, the American Academy of Pediatrics, the Connecticut Department of Public Health. MPS will continue to follow those requirements and will continue to rely on recommendations from the medical health and science experts in the field when determining and implementing the health and safety and mitigation protocols. What product, and by product in this context, it's mask, are you providing our children? What study did you use to make that choice? So the study kind of answer is really what I just said in regards to the previous question. And the providing of masks, essentially, we will supplement what parents provide, but parents, the onus is on providing masks on parents. If they're unable to do it, we'll provide them. So all students, we will provide all students with a layered cloth mask at the beginning of the year. Schools have surgical masks ready in the event that a student forgets or requires a mask. MPS mask guidance is aligned with the CDC guidelines. And we do not conduct or consult a study. Again, we're relying on the medical health and scientific experts in the field, such as CDC, DPH, and AAP. Who will help my 4-year-old daughter adjust her medical device? Parents with individual health-related questions such as that should contact the school nurse. The important point, and this is a quote from the plan, the important point about masks is that our masks will help protect each other. Who are you using to back up this language? Who published it and when? MPS mask guidance is aligned with CDC guidelines. Again, we're relying on those aforementioned experts. Why did you choose to use the PCR test in the containment plan, even after I informed you at the BOE meeting that PCR tests, according to the CDC, can't differentiate between COVID and the flu? The viral test, COVID-19 molecular assay for detection of SARS-CoV-2 RNA, which is a PCR or an AAT test. That's the recommended test from the CDC, Connecticut DPH, and part of Connecticut's return to school guidance. This type of PCR is a COVID-19 specific PCR test. From the containment plan, at what age will children be isolated and left in a room alone? Students will be supervised in the isolation room. They will not be left alone. Will the COVID-19 vaccine become mandatory? Per the Executive Order 13D, vaccination for COVID-19 is now mandatory with exceptions for MPS employees. At this point, if you're an employee on the other end of the line, we have many questions from the state that we're waiting on answers for, and from legal counsel. Once we have answers to those, we'll move forward and be communicating out with our staff about a process. Do students have to be vaccinated? Vaccination is recommended, but not required for eligible students, which is currently 12 and older, but again, not required. Will teachers and students be able to use a medical or religious exemption for the vaccine? Vaccines are voluntary for students, so there's no exemption. COVID vaccines, that is. And under the current executive order, employees may apply for a medical or religious exemption from the vaccine. Again, we're still waiting on more information from the state and council regarding vaccines, more to follow. How will students and staff get weekly tested if they opt out of the vaccine? Will elementary students also be given the choice for weekly testing? So there was a slide in here. Elementary students are going to be provided a voluntary weekly testing if their parents opt in. And we don't currently have a plan for testing for staff or grades 7 through 12, but we'll work with our partners on future possibilities. Again, that falls into the category of when it comes to 13D, really waiting on more guidance. So if you're joined late and you weren't able to view the slide about lunch, here it is again. It was a question that was submitted. Will students eat in the cafeteria or classrooms? And the answer is a combination of both, and a combination of outside time, a combination depending on the school. So your school will provide you with school-specific information, but here is a list of what the plan is for lunch currently. Nowhere in the academic plan do you acknowledge that MPS doesn't meet a single state metric and what we're changing to better suit the meeting the needs in the competencies and scoring guides. So continuous improvement in all that we do is core to who we are, what we do, and our mission. State accountability measures, we use them to develop and drive school and district strategic plans. Those plans articulate the improvement strategies that we have in 4 priority areas: academic excellence, social and emotional well-being, systems for student success, and talent development. Again, we use that data to drive improvement. Continuous improvement in all that we do is central to our mission. Why should individuals who have previously tested positive for COVID-19 or who are fully vaccinated have to quarantine? Well, the answer is students and staff previously diagnosed with symptomatic laboratory confirmed COVID-19 who remain asymptomatic after recovery, retesting or quarantine is not required if the exposure occurs within 90 days after the symptom onset from the initial exposure to or laboratory confirmed date. So if it's within 90 days from the exposure is 90 days from when the person had COVID, they do not have to quarantine based on that exposure. Fully vaccinated individuals do not need to quarantine if their exposure, if they remain asymptomatic. They must provide proofs of vaccination. They should get tested 3 to 5 days after exposure and should wear a mask in public until they get a negative test or 14 days after that exposure. What are the plans for the mental health of students if you choose to close the doors again at the high school and the middle school? I just want to reiterate that all decisions are made with those guiding principles: safety, the safety, health, and well-being of all of our students, based on a variety of factors, including the prevailing guidance at the time, density, human resources, a lot of things go into making those decisions. Again, I'll say we're hopeful that we'll be in school in person for the entire year, but we have contingency plans just in case. So I think I mentioned this before. We're partnering with local mental health agencies to provide additional support to students and families. The services will be in place no matter the learning model. So if we're in person or we have to shift to virtual. What's being done to help students not as worried by COVID as some? There seem to be some very shy to send their kids into school and are asking for more COVID restrictions. And are some parents who don't want extra things in place. Just have to move the box here, excuse me. How are you supporting the parents frustrated at the slow timeline of removing restrictions and coming back to a more normal school year? So I think I just started to answer this one as well. The health, safety of students, faculty, and staff remains our priority. Our return to school plans and procedures have been developed in collaboration with the Naugatuck Valley Health Department and in alignment with guidelines from the CDC, DPH, and CSDE. Will statistics on vaccination of staff and students be provided, especially for elementary schools where students can't get vaccinated yet? So, well, with the recent executive order mandating vaccines for school employees, all staff except those who qualify for the exemptions will be vaccinated by mid-October. So we hope that it's the majority and close to all. Naugatuck Valley Health Department reports that 42.6% of Naugatuck's 12 through 17-year-olds are fully vaccinated. DPH posts the vaccination rates by town on their website. So yes, we can continue to monitor that. We've scheduled some vaccination clinics coming up, knowing that quarantine is differing and that some of our athletes are interested. We're hoping that 42.6 goes up, and we'll keep you abreast of any change in data. Why isn't remote learning an option, considering that cases from the Delta virus, including hospitalizations, including children's hospitalization numbers? Also, why aren't parents included in the decision-making about full-time in-person school, especially now? I feel that parents are not having a say or options in anything. As a parent, I'm scared of the unknown and what can happen. I'm sure you can understand my concerns and worries. We do understand and we do value very much the input of parents and members of our school community. There are parent members on our return to school committee, and we have solicited feedback and revised the return to school plan, as well as ARP and ESSER plans based on the solicited or received feedback. As it stands, the decision to allow remote learning option will have to come from the governor or legislature. And if things change, we will let you know. But as of today, a remote learning option is not permitted as a choice for families. It's only permitted in the emergency sort of short-term rather support for students who need to quarantine or self-isolate because of COVID. If the Delta variant continues to pick up speed, at what positivity rate will you offer distance learning? Again, it's not a cut score for us. As it stands, that's a decision that will come from the governor or legislature. As of today, remote learning is not an option permitted under the law. And now, if we can, Mrs. Cooney, open it up to questions that may be in the chat.
Sure. So we had a question about the PCR test, which you spoke to because you had that question sent to you, and that we are recommending the PCR test that specifically identifies COVID-19. We also have a question about the weekly screening and whether we're using a throat or nasal swab. And we will be using the nasal swab, or the company that we're working with will be using the nasal swab. And they made sure to let us know that it was not the traditional deep swab that was happening at the beginning of COVID-19, but a less invasive swab that will still detect COVID. We also have a question about mask breaks in schools.
Yeah, so that's a really good question. Sorry that I sort of went right over that. Yes, we'll continue to provide mask breaks in school. We purchased this year, as you're driving by the schools, although we had to take them down for the tropical storm that luckily wasn't what we anticipated. We're putting them back up. We purchased better tents, more permanent tents this year for outside activities, mask breaks, et cetera. Yes, we'll continue to provide those.
And so far, that's all we have.
Okay, we can give it another minute or two.
Sure. And how often for the breaks? And will we be providing new masks per the CDC guidelines?
Great. So we'll be providing the layered cloth masks, the Nagi masks, which are cloth, multiple layers, and surgical masks in the event that, so we'll give everyone a Nagi mask. And then the other masks are backup masks. If a kid forgets them, it breaks, it gets soiled, etc. So we'll have surgical masks on hand in the event that a child forgets one, or it rips, etc.
So we had a question about contact tracing when students and staff are outside without mask breaks on, and whether or not they need to quarantine.
Not unless they are within 3 feet for 15 minutes outside, which we are going to design it so that they're not. So it would be atypical.
And we
Oh,
have,
you know what? I think you asked me before the frequency of mask breaks.
yes, I did.
And there isn't something that's set in stone. That's going to be developmental based on need, how hot it is. So we will, we're going to gauge, we'll take them as often as we need to, based on the students. And that'll be scheduled, at the school level, and schools can communicate out if they're going to have, X amount of mask breaks per day. It'll be much like last year. Only last year, the beginning of school was nice and cool. So we're hoping for a nice, cool start to the school year this year as well.
We had a question, which I'm glad someone asked this, if students are allowed to wear their own masks or just the ones we provide.
Oh, no, definitely your own. As a matter of fact, the majority of masks worn to school every day,
Yes.
Last year were ones that parents bought. Yeah. The cloth mask is, just to get started, a little Noggy pride with our end masks. And then we have backup masks in the event that something happens. Yeah.
And I just want to clarify that the weekly voluntary screening is a nasal swab. And someone is asking if the results are provided weekly to parents.
Only if they're positive.
Right. And we have a question about drop off and teachers escorting children to from cars.
Yeah, so arrival and dismissal will look very similar to last year, but if it's a school specific question, I think the best thing to do is to get that information from the school, since offhand I can't speak to each and every school's procedure. Arrival dismissal will likely be very similar, but more information, school specific information will come from and should come from the schools in that regard.
So we have a question about a mask exemption. If a parent has a question about a mask exemption, what should they do?
Okay, so they should contact their school nurse.
Right. Yep. And then another question will students have books this year, or will they just be using Chromebooks?
Nope, students will have books and Chromebooks. Students will be able to take books out. Students will be able to use the classroom libraries. Yep, we're not concerned about the sharing of materials that the CDC, DPH, it's really not transmitted through touch like that. So we've learned, and that'll be good. Be good to, go take a book off the shelf and read it for a little while.
And a question about fans and if they're allowed to be used in the classrooms.
Fans are allowed to be used in classrooms as long as they're blowing out, not across the room. So they can be used sort of as to exhaust and pull air out. Yep. But that's a box fan that's in the window to point it out to exhaust, not a freestanding fan that would blow air across people.
And another question came in about when schools will be sending out school-specific information.
I guess I can't give you a date right now, but we'll circle back to you and we'll talk with our schools tomorrow, and you should be receiving them soon.
Yes.
That's a good question too.
It is. And a question about the bus schedule, which
I think was just posted today, right?
Posted on our website. And a message will go out tonight on Parent Square regarding the bus routes.
Yes. It's not coffee. I'm just drinking some water. It looks like a coffee cup. If I drink coffee now, it'd be up.
So we have a couple more minutes. If anyone has any additional questions, you can throw them right into the chat.
Well, I just want to say thank you all for being on the other side of the screen. I can't see you. That's a little, I mean, we should be used to that by now, but I don't know that you ever get used to that. Talking to a PowerPoint and just to Mrs. Cooney and a little picture of myself there. If, please feel free to reach out to either one of us if you have questions that you thought of after the fact. And again, this will be posted at some point in the next couple of days on our YouTube, I think on the YouTube channel that we have, so that folks who didn't have a chance to view it can view it. Everything that we had shared today believes on our plan, but I know that sometimes verbal and opportunity to engage in some questions works for people as well. So we are, I see a couple of chats coming up. I don't know if those are questions or not.
There's a lot of thank yous.
Oh, great.
And
Well,
thank you for attending. Yeah.
Yeah, I know. Thank you very much. We are poised to have a great school year where we can't wait next Wednesday to get kids back in school. We were busy this summer planning. And then everything that first day of school when we welcome kids and we see them getting off the buses, how excited they are to go into their schools, see their teachers, meet their friends, albeit behind masks. Our kids are resilient. They did a great job. They'll do another job, and it's going to be a really great year, So we look forward to a great year. Thanks so much for attending, and we will see you real soon.